I'm Helen, a urology nurse specialist with the Urology Foundation. You are watching this series most probably because either yourself or a loved one has been diagnosed with bladder cancer. Receiving a diagnosis of bladder cancer can be overwhelming. It's a very anxious time and it's very normal to have lots of questions. In this video, I will walk you through the basics of your diagnosis. The tests and scans that you've had so far will give information to your medical team about the type, the stage, and the grade of your cancer. Understanding this helps them plan the best treatment for you. And we understand that this can often feel very confusing. You may receive clinic letters where there are numbers and letters at the top of the page, and it's very difficult to get your head around this. So the first thing to really understand is the type of bladder cancer that you've been diagnosed with. The most common one is urothelial carcinoma, which can also be called transitional cell carcinoma, and it's the same thing. It starts in the lining of the bladder, and it can be non-muscle invasive, so it sits superficially just on the lining on the inside of the bladder, or it can be muscle invasive, which means that it started to grow a little bit deeper into the side and into the muscle. There are other types of bladder cancer as well, so you may hear squamous cell, adenocarcinoma, small cell, and very rarely sarcoma. The next thing to understand is the stage of your bladder cancer, and this really refers to how far the tumour has grown, if at all, or if it has spread. And your medical team often use the staging system TNM, which you may see on your clinic letters. So the T refers to the depth of the tumour into the bladder wall, if at all. The N will refer to any of your little lymph nodes around the bladder, whether they are involved. And the M refers to whether or not the cancer has spread outside the bladder itself. You don't need to remember any of these terms. Just be assured that this helps guide your treatment for the best possible outcome. You may also hear about the grade of the bladder cancer. And this really refers to how the cells look under the microscope, how likely they are to spread. So, for example, a low grade tends to grow a lot slower. And if you have a high grade tumour, it's likely that more active treatment is necessary. So you may go on to have a few more tests. The first one is called a cystoscopy, which is a small camera which goes down the natural passageway into the bladder to check the lining of the bladder. You may have already had this, and you may have a few more over the length of your treatment. It just keeps an eye on the lining of the bladder. You may have scans such as a CT scan or an MRI scan, and this really checks the bladder in greater detail and the area around. You may have further biopsies, which are small samples taken of the tumour to be looked at under the microscope. Blood and urine tests are often taken. This is to really just check your general health, for example, how well your kidneys are working. Remember, each test helps the team to build up a clear picture of the type of cancer you have and the most suitable treatment for you to go on to have. And they are there to answer any questions that you may have. So if you are unsure, keep asking questions until you fully understand.